South Carolina health workers are warning there's a statewide outbreak of hepatitis A. Look at those counties shaded in blue this morning. Most of the counties and the cases are down in the Midlands. Aiken County has a lot, but we've got a handful here on the upstate as well. You can see Spartanburg and Anderson also affected. Fox Carolina's Ashley Manelli is live at the Greenville Department of Health with how we can be aware of what's going on, Ashley, and protect ourselves.
Yeah, and the one thing that doctors and state health officials say is, especially for children and people who have chronic illness, cancer, get a vaccine if you are comfortable with that. That's the best way to protect the people most at risk. There are 86 confirmed cases here in our state right now. A handful of those are in the upstate, about 13 confirmed cases between Greenville, Spartanburg, Anderson, Greenwood, Union, and Cherokee counties. So people who are typically getting this disease, state officials say, are those who use drugs, as well as those who live in communities that are close by each other. Recently incarcerated people are one example of a group, as well as if you bring the virus home, you're more likely to infect people in your household because it can spread through contaminated water and food. It does infect the liver, and we know it can cause complications, as I mentioned, for those suffering from other diseases.
Most hepatitis A is what we call self-limited. In other words, in people who are otherwise healthy, they should not have lifelong problems or concerns. Typically, it causes nausea, vomiting, and diarrhea, and those symptoms can be very severe.
As you just heard from Dr. David Brancati with Emergency MD, he does encourage people to get the vaccine, especially children. But again, keeping yourself clean, good hygiene, washing your hands, avoiding food and water that other people who are sick have drank or eaten is the best way to protect yourself. You can also come to health departments like the one behind me, call them up, talk to them about how to prevent, and of course, get that vaccination if you're interested in it. Lauren, Ted?